Senator Judd Gregg has his own plan for health care. So is he going to show it to the president tomorrow? Not exactly. Earlier, Senator Gregg went on the record. Senator, the president has said that he wants a plan from the Republicans. I know the Republicans put one online in November. You also have a plan. When did you come up with your plan, first of all, and how does it differ from the president's?
Well, we came up with ours losing track of time. We've been at this for so long, but about last May. And basically, I put it out there in the public domain, sent it down to the White House even when I first introduced it, or introduced the concepts. And then a couple weeks ago, I sent it down again because the president said I'd like ideas. So I said, here's some ideas.
Sent it down what form?
I sent it down in an outline form. So
in a letter, then? In snail mail?
A letter with an attachment that outlined what it did. It's a very comprehensive proposal. It basically creates what I think a major movement towards getting our healthcare system to be more inclusive, so everybody would be able to have access to healthcare insurance, catastrophic. And secondly, it aggressively promotes prevention and healthy lifestyles. And thirdly, it aggressively promotes getting providers to deliver healthcare services on the basis of quality rather than repetition, quantity, and having cost-plus healthcare.
What's the major difference between, or the starkest difference between your proposal and the president's that he posted the other day?
Well, the one he posted the other day was an addendum to the Senate bill, and you can't look at it separately from the Senate bill. But basically, mine uses the private sector. Mine is not a massive expansion in the size of government. The president's is about a $2.5 trillion increase in the size of the government. At least that's what the Senate bill ended up being. And mine uses the marketplace to incentivize people to be more effective in the delivery of health care and control health care costs.
One of the sort of, I use the word interesting, if it weren't so serious, interesting sort of understates the importance of this, but is that the president has said that he has not heard from the Republicans on a proposal. That apparently is not so, at least as he responded to your proposal.
Well, actually, I had a couple of discussions, my staff with his staff and myself with the chief of staff at the White House on this proposal.
So they've had it, they've heard it, they've considered it, they probably just don't like it particularly well. Seems
that way. It didn't make it past the cutting room.
Are you going tomorrow?
No, I'm not, no.
Were you invited?
My leadership came to me and asked me whether or not I'd be interested in participating. I think they went around to a number of members and asked that question. I said, well, if I can present my ideas, I will be. But as a very practical matter, it's probably not the best forum for me.
Why wouldn't you be able to present your ideas? The president said that he wants to hear from people. You don't believe that, or the leadership wasn't going to let you give your idea? Why wouldn't you?
No, I have to be honest. I think there's going to be a bit of a kabuki dance tomorrow. I honestly don't. I know everybody's going to make their position clear, and they're going to say the words that everybody says about being positive and constructive, and we all want to be working together. But in the end, I think we're headed towards an exercise in reconciliation here. Reconciliation,
we're hearing a lot about that right now, but there really is nothing to reconcile at this point. Is that right?
Well, that's the point. We are hearing that they want to run a reconciliation bill through the Senate, which would reconcile the Senate bill that hasn't passed yet. Now, reconciliation is a term of art, but basically what it means is you change the law to adjust spending or taxes which already exist in the law. Well, if the Senate bill hasn't been passed yet, how do you reconcile it? But that's the proposal that's being floated around here.
All right, now there's a lot of controversy over the use of reconciliation.
There should be.
There should be?
Sure, this is a railroading of the system. It's basically saying no amendments, 20 hours of debate. We're going to pass the most significant piece of public policy in my life experience, which is a massive rewrite of our healthcare system with a huge expansion of the federal government, a huge intrusion of the federal government into the private sector. A lot of people will lose their private insurance and be forced onto these exchanges.
Do you really expect that reconciliation will be the route? I guess we should say reconciliation means that it doesn't get a 60 vote, doesn't need 60 votes, but it needs 51.
It needs 50 votes, 20 hours of debate. No amendments are really debated. There can be amendments offered at the end, but they get 1 minute of debate. And you have an up or down vote for 51 votes. And the purpose of reconciliation is to basically adjust the budget numbers in order to correct inconsistencies between spending and what your budget says.
And one of the things that I've heard is the Democrats say, well, the Republicans have done it before, and the Republicans say the Democrats have done it before. On the issue of reconciliation, and have the Republicans done anything remotely similar? Not that that should necessarily be an excuse to change procedures now, but is your party guilty of doing that, sort of shoving it down someone's throat in an area that shouldn't be subject to reconciliation?
No, not in my opinion. Reconciliation, in my experience, has been used 3 times, and twice it was done in a bipartisan way, and once it was done on the tax reductions that President Bush put in place. But you've got to remember that's adjusting rates, you know, and adjusting rates is a fairly clean event as far as the policy involved and as far as what the issues are, and the language is very simple, you know, I'm going to raise this rate, I'm going to lower that rate. We're talking now about changing the entire way that healthcare is delivered in this country. We're talking about taking the federal government and growing it from 20% of the economy to 25, 26% of the economy. We're talking about changing the way that you and your doctor interact, and you and your hospital treats you. These are huge public policy issues which really are way outside the reconciliation concept, because they need debate, they need discussion, and they need to be subject to amendments on the floor of the Senate in order to do them correctly, or at least to have a proper airing of them and a fair treatment of them.
One last quick question. Are you going to watch tomorrow?
Well, we've got Chairman Bernanke before the committee that I serve on up here, so I may be listening to Chairman Bernanke, but I'll certainly tune in as often as I can.
Or maybe TiVo?
Yes. Well, I'm sure there's something happening at the Olympics.
Thank you, Senator.
Thank you.